I see that in my other patients as well, how they get sucked into these needs to show up for this and this and this and this and this and this and that. And then they're so exhausted and they come to me and they want a medication or they want a procedure or they want, a supplement regimen. And I'm telling them, you need to go to bed before 11 p.m. You need to get 7 to 8 hours. You need to wear blue blockers and stop staring at screens before the evening. You need to eat whole foods. You need to take a deep breath and meditate. And that is not the answer we're accustomed to getting from our medical professionals. But at the root of it, it is the most important things we need to be doing.
Hello and welcome to Nourish. My name is Kasha and I'm a holistic life coach and second-year doctoral student studying acupuncture and traditional Chinese medicine. My mission with this podcast is to share the stories of inspiring humans who have discovered that elusive state of balance between striving for success and having that sense of interconnectedness and spirituality. Think yin and yang in flow. Now, as a former Silicon Valley burnout escapee myself, teaser, I left the tech world after 11 years of a successful career in product management. I know firsthand how difficult it can be to integrate the two. This podcast shares the stories I wish I had heard when I was struggling to find that balance and flow myself. My hope is that these interviews inspire you and give you the tools to rethink your own approach to mental, physical, and spiritual well-being. And if you are struggling, help you find your way back to authentic alignment. Now sit back, relax, and ground yourself back home, and let's get started. Hello, sweet souls, and welcome back to the Nourish podcast. This is your host, Kasha, and I am truly on cloud 11 after just wrapping up a conversation with your very next guest, who is Jessica Kolahi. Jessica is a physician's assistant, acupuncturist, herbalist, Chinese medicine, nutrition expert, and she specializes in full spectrum women's health care and longevity. Jessica served as a hospitalist at Stanford Healthcare in the inpatient Gynecologic Oncology department, and she works as adjunct faculty at multiple acupuncture schools, teaching Western biomedicine. Now, as you can imagine, this episode is really exciting for me because Jessica has the knowledge and perspective around both allopathic Western medicine and traditional Chinese medicine. So we really do dive into integrating the two. We also talk about Jessica's work as a functional medicine practitioner, what is functional medicine, and how identifying the root cause of disease is just so important in terms of healing. We broke down some specific patterns in Chinese medicine as they relate to Western diagnosis. So we kind of even went into an example of integrating the two in terms of how to think about it. And we talked about longevity, we talked about optimizing for long-term health, and so much more, y'all. Now, before we dive into this conversation, which is chock full of incredible information, I want to share a couple of quick shout outs. First thing, this episode definitely dives into some thinking around patterning in Chinese medicine. So if you're not familiar with Chinese medicine at all, please check out the show notes for my Chinese Medicine 101 podcast, where we introduce some of the concepts we're going to be talking about. Now, the second thing I want to share is that Jessica has generously provided some goodies for us in the show notes. Jessica shared a self-care PDF of her morning routine for increased energy, balanced hormones, and to help release weight. So please be sure to check it out. Also, Jessica has an incredible 11-week group program to help mamas detox and release weight with whole foods while receiving support in mindset and emotional mastery. And this is accessible for women everywhere. As Jessica describes in the podcast, weight loss is not just about calories in versus out. So if you're looking for an integrative solution, this one sounds amazing. Honestly, I wish it was not for mamas. I'm like raising my hand here because I would definitely join. So the code is NourishPod, all caps, for 10% off. And I have all the links and details in the show notes. Now, without further ado, I'm so excited to jump into this and welcome Jessica Kolahi to the Nourish Pod. Jessica. Oh my gosh, I am so excited to finally get to do this. This is a long time coming. Welcome to the Nourish podcast.
Thank you. I am so excited to be here. Can I share a little bit about how we met?
Yes, please do. I would love to hear your perspective on that.
Yeah, so I was teaching anatomy for the first time ever, and Kasia was in my classroom, and she emails me out of the blue and said, "I have this podcast. I'd love for you to be on it." And I was like, "Oh, is this like a student side project or something?" But in any case, I look up the podcast and it is outstanding, out of this world. I was not expecting this quality, and I look more into you and your background, and I am so excited for the provider you are going to become as well. So it's pretty amazing to be here.
Oh my gosh, I was not expecting that. Thank you so much for sharing that. And yeah, you've just totally made my week and weekend. So thank you for that. And I am so excited for this particular conversation because a lot of the topics that we're going to be covering, as I mentioned, are like hot questions that I get in terms of requests. These are actually some of the key requests that I get from a lot of listeners. So I think this will be a really rewarding conversation. But before we get started, I'm going to start with a question that I like to ask each and every guest. And that is, what are 3 words that you would use to describe yourself?
Yeah, so the words that feel most resonant for me are curious, inspired, and determined.
Oof, I love those. And, since you did mention that you were, when I was at ACTCM, my professor, I feel like those absolutely kind of came through in your teaching style and your energy. So I kind of wanted to reflect that back.
Thank
Although
you.
the inspired bit, I think, yeah, I could see that too. You made anatomy sound very inspiring.
As much as I could. I love anatomy. I would love for everyone to be as inspired by it as I've become.
Yeah. And your depth of knowledge, I mean, that was one of many reasons why I thought you would be so perfect to have on as a guest. So let's dive into that. So, Jessica, you're a Reiki and Healing Touch practitioner, physician's assistant, acupuncturist, herbalist, Chinese medicine nutrition expert, and you specialize in full spectrum women's wellness care. You've served as a hospitalist at Stanford Healthcare in the inpatient gynecological oncology department, and you work as adjunct faculty at multiple acupuncture schools, teaching Western biomedicine. Now, before I dive into all of the questions that are associated with that very, very impressive background and kind of range and diverse knowledge that you have, I want to share a couple of quick definitions for the audience. So, physician's assistants or physician's associates, otherwise known as PAs, are licensed clinicians who practice medicine in every specialty and setting. In California, they essentially operate much like a physician, prescribing medication, x-rays, labs, diagnosing, and even performing minor surgeries. Actually, I recently got a biopsy, and it was a research physician's assistant that was biopsying my skin. So that we had a whole conversation about that. That was pretty interesting because she did a lot of surgeries. Many PAs already have 2 or 4-year academic degrees before entering a PA training programs, and most PA training programs require prior healthcare experience. Now, to be a licensed acupuncturist in California, you need between 3 to 4 years of education, very, very rigorous education, as I'm experiencing firsthand right now. And the program is a master's program. They also have doctorate programs, but by default, it's like you need a master's to practice in the state of California, at least. And so these are super rigorous programs. And since I studied with you at ACTCM, Jessica, I am so aware of your incredible breadth of knowledge. Can you give us a quick overview as to what inspired you to really pursue both of these sides of medicine, like more allopathic Western medicine and also East Asian medicine theories? Because this is a lot of education and really, really complex bodies of knowledge.
Yeah, so the choice to go into Chinese medicine was less intellectual. I was 21. I felt I was in this transition in my life, and I just had an impulse. I don't know how else to describe it. I had an intuition that told me I needed to change directions. I needed to focus on healing people in one way or another. Through random searches on the interwebs, I came across ACTCM. I, at the time, was living in Connecticut, was slated to go back to school at University of Vermont. And just something in my heart told me I needed to shift. So I connected with the people at ACTCM. It was the only school I applied to. And within a few weeks, I had sold many of my belongings, packed up my car, and was driving across country to start the new chapter of my life. And so I would say that decision was completely driven by just intuition and this feeling that I needed to go in that direction.
And wait, before we even move on, I'm curious, you mentioned you were about to go back to school. Like, what was your path looking like, just to kind of set the context for where you were coming from?
Yeah. So my original high school dreams were to go to law school and work in politics. I felt like I could make changes by working through our government. And I had some really interesting experience doing the beginnings of my political science degree. And then I had spent a year in France working on different political campaigns and studying there as well. And something about that experience really told me that it was not for me, that I wanted to work with people one-on-one and get really deep and connected. And I love the world of politics and making change in that direction, but it just has this broader scope. And my heart wanted more one-on-one connection. So I came back thinking it just didn't make sense for me to go to law school anymore. And I needed to go dive in a different direction and feel how that felt.
I love that. So it sounds like studying Chinese medicine, acupuncture, that came first. And then what inspired you to expand on your education to also become a physician's assistant?
Yeah, so I followed my husband to Oregon after acupuncture school, and I started my initial acupuncture practice at that time. And I ran that for several years. The reason I followed my husband up to Oregon is that he was enrolling in an MD PhD program. So simultaneous to me developing this acupuncture practice, fine-tuning my skills, getting more and more complex patients, I was observing what Kevin was learning, and I think I got a little bit envious. I wanted to just learn more. I knew that I was young and energetic and I had the energy and time. And I guess along the same vein, I had this impulse. I had this drive. I just needed to learn more. And so I followed that and I sold my acupuncture practice and applied to PA school. And that's how I ended up there.
Oh my gosh, I love this story. I love it. And approximately, like, how old were you when you decided to kind of not pivot, I would say, but expand? Because that's kind of what I'm hearing you describe.
I was about 30 years old, and it felt like now was the right time for many reasons.
I think that will be so inspiring to hear. I mean, it's very inspiring for me to hear as somebody who is currently 33. I started acupuncture at the age of 32. So just kind of in that range, general age range. And it can be terrifying to go back to school after already working. And it sounds like you had an acupuncture practice, which you were choosing to sell to go back to school. And your husband was in school at the time. What was that experience like for you? I'm curious about like that whole transition and also trying to sustain yourself while you're making all of this happen.
Yeah. So luckily I was able to sell my practice for a profit, and that helped sustain us financially for a little while, because that's always a big fear when you're making a big transition. There's definitely some financial rearrangements that happen. But I would say the transition from being a respected professional doing what felt like very meaningful work in the world to becoming a student was very humbling. You tend to develop a very good impression of yourself when you can see right in front of your eyes the people that you're helping and the relationships that you're building. It feels really amazing. And then going back to being a student where you sit in a room and you toil we were in class from 8 a.m. to 5 p.m. Monday through Friday. I think we got like a couple weeks vacation in the entire 2.5-year program. So it was nonstop. And I kind of surrendered to that experience. But in the beginning, it was definitely a little bit jarring to go back. And of course, I'm grateful to be on the other side. But there were definitely moments in the beginning of my training when I was wondering like, oh, I don't think I realized this would be this way. And Did I make the right choice? But I think that happens in any big life transition. You always have those questions and you always have to tap into your heart and continue to pursue what is most important to you at that moment.
Can so deeply relate to that. It's like a roller coaster. Like, yes, this is the right decision. You're feeling good about it. And then boom, like, what am I doing? Even introducing myself was difficult for some reason, or is still sometimes difficult, not so much now because it's been a year, but just to have introduced myself in a very professional setting with the work that I was doing, identifying as somebody that does X, Y, and Z, and then to go back to school to study. For some reason, I have found that to be difficult, like almost like an identity crisis. So I really appreciate you sharing that. But I don't want to spend this entire time talking about this, as curious as I am, and I'm going to ping you offline about all of that because we have so much juiciness to get into with regards to women's health and kind of the reconciling of studying allopathic medicine with also Chinese medicine. So I'd love to start there. A lot of what we learn in Chinese medicine, as we learn kind of the philosophy and the theory of Chinese medicine, doesn't always align with what is described kind of on the allopathic Western medicine side of things. And so, as somebody who has experience in both, I'm curious, and also somebody who actually teaches both, right? Or, you teach anatomy, you teach Western biomedicine, but you're also practicing kind of looking at both sides of things. How are you reconciling it in your mind? And could you also explain for the audience, and this is very complex to do, but what are some of the core differences between the way that the two medicine styles approach treatment, and how are you reconciling the two?
They are very different, but they both have the same goal, which is to make people better. I think when I went to PA school, my initial thought was I would exit PA school as like an undercover acupuncturist that now had an inside scoop on Western medicine. But like all things, I was also transformed by it and I saw the value in it. And I was changed through the process, which was also very valuable. I think one of the major differences is that Chinese medicine is about finding patterns in the body. We're looking for how do these symptoms correlate with everything else that's going on in the body so that we can find a pattern, help that pattern come into more alignment with the body, develop a state of balance, and through that promote optimal health. Western medicine or allopathic medicine is more focused on what is a disease and how do we stop a disease. The thought process is also very different. Instead of searching for patterns and seeing how they come together, allopathic medicine is creating symptoms of possible diseases and trying to X them all out. So rather than ruling things in, you are ruling things out. So I've struggled quite a bit in the beginning of PA school because I needed a complete mental shift to be able to separate how both medicines actually think about the body. I think one of the disadvantages of allopathic medicine is that if you don't have a disease, there's really no treatment. And that's actually where functional medicine has come from. Functional medicine is one of the new medicines that I'm incorporating into my practice. And it brings in some of those functional aspects of Chinese medicine, which is looking at the body and trying to make it better, not necessarily finding a disease and treating a disease. So I would say Chinese medicine has that leg up on being able to optimize well-being, helping people come into their own balance. But there are definite tools in Western medicine that are very helpful, the diagnostic tools, and in very sick people, medications. So I've been finding my own way to bring them all together. That's what my current project is in my own personal private practice, is trying to leverage all of the best of each of these medicines.
I love that. So tell me about functional medicine, because I know you mentioned that. What is functional medicine? And is that kind of the foundation that you are building from, or kind of tying Chinese medicine and allopathic medicine together with this bow, which is functional medicine? Describe that for people who don't know, including myself.
I think that's a great analogy. It does feel like the bow for bringing them together. Functional medicine is a newer type of medicine. It is focused very much on diet and lifestyle coaching. It is putting the power back into the patient's hands. It is using natural herbs and supplements before having to go to medication. So going from least invasive to more invasive practices in medicine. its foundation, functional medicine is searching for root causes of disease using the lens of Western medicine. So for a lot of my patients, because of functional medicine labs that have come out, I can do complete hormone panels. I can do stool testing to look at the microbiome. I can take a look at inflammatory markers and correlate them with food sensitivity testing. So it's using these really complex and in-depth labs, but at the root of it, finding how can we help these patients heal themselves in the least invasive way and empower them to make the changes necessary to heal themselves.
Well, that sounds like kind of the equilibrium between these two styles. So, question for you, and I don't know if there's a very specific right answer to this, but when you say Chinese medicine is focused on recognizing patterns, which I definitely can relate to that based off of the education I've been getting thus far, do you think that Chinese medicine is as interested in also the root cause of the patterns? And the reason why I ask this is actually a very specific experience that I'm having. I'm currently in observation too. And a lot of the time I have patients that come in and, we kind of walk through the patterns that we've recognized in that patient. And I find myself thinking, okay, well, how did they get to this point? Whatever pattern X is, which also is very fluid and can change throughout even, whatever period of time. And so what are your thoughts on that? Like, is that something that is also a goal of Chinese medicine, or is it more about this is the pattern that we're seeing, let's focus on treating that pattern?
So I would say that the absolute goal for both Chinese medicine and functional medicine would be finding that root cause. I will say that Chinese medicine is a science and an art, and being able to access that root cause takes experience and honing diagnostic skills. The root cause is there. Sometimes you need to wipe away the other patterns to be able to even access it. Some people have that special gift and they can get right to it. But if other things aren't cleared first, maybe that alone isn't enough to get people to that next stage of healing. So when I was practicing just acupuncture, I did specialize in infertility at the time, and I would oftentimes see what the surface pattern was, but also work my way down to the root pattern. And my goal was to treat them both simultaneously, depending on which had more correlation with the current symptoms at hand. If you have a true kidney deficiency, but you also have a lot of stagnation and stress in the body, as much as you nourish the kidney, you can make that stagnation worse. So you have to work all parts of it, recognizing what the underlying cause is, but seeing the delicate balance between everything else that's going on.
That's a very good explanation. So let's actually talk about some examples. I know that in your practice, you specialize in full women's care and you have a particular interest in balancing hormones and promoting longevity. Both of these topics are very hot topics in our day. I know that if we're not talking about kind of hormones and fertility for women, especially, we're talking about how to age gracefully and kind of stay healthy for, however that's defined for a longer period of time. So I'm curious, when it comes to, let's start with hormonal balance for women specifically. What are some of the common conditions? And maybe we can start with symptoms and then talk about how they're defined and how you would look at them across both allopathic and Eastern medicine. So what are some of the common symptoms or issues that women come to your practice experiencing?
So one of the reasons I love talking about hormones is that it's such a broad topic. I think when we think hormones, initially we're thinking sex hormones like estrogen, progesterone, testosterone, but hormones are so much more. We have stress hormones like cortisol and neurotransmitter stress hormones like norepinephrine. We have thyroid hormones. We have insulin. So hormones are this beautiful dance of chemical signals in the body, and finding a way to get balance between all of them, I think, is an amazing goal that's always what I'm striving for with my patients. So symptoms of hormone balance can be really varied for that reason. It can be difficulty sleeping, low energy, depression or mood problems, difficult digestion, bloating, certain skin conditions. So hormones are often not the only thing going on when we have a lot of these symptoms, but if we don't address hormones in addition to the other underlying pathologies, then we're missing a really big part of the treatment.
Wow. it sounds like there are a whole range of symptoms that women will come in with. In terms of some of the common conditions, like if you were to translate them perhaps to Western medicine conditions for a lot of folks who are listening, that those are probably the terms they're more familiar with. What are some of the conditions, quote unquote, that, once you kind of dig into some of those symptoms that you see the resulting disease might be or imbalance might be?
Yeah. So difficulty sleeping or fatigue, a lot of times there is a cortisol imbalance in the body. I know Western medicine doesn't like the term adrenal fatigue at this time. It's a big hot button. But the truth is that we can have imbalances in stress hormones that aren't necessarily diagnosable diseases, but have true symptoms in the body. From the women's health perspective, the dance between sex hormones and insulin and stress hormones you can see in diseases like PCOS. Of course, there's other diseases like endometriosis. That's more strictly an sex hormone condition, although it often also has to do with detoxification pathway problems in the body.
Yeah. So, in terms of, okay, first of all, I need to ask when it comes to adrenal fatigue, you mentioned that's something that we're not really talking about in Western medicine, but, I feel like so many women, men, quite frankly, are experiencing this, right? First of all, like, how is that defined? And what are some of the symptoms that people might come in with when they have adrenal fatigue?
Yeah, so I think that adrenal fatigue is a hot button in Western medicine because, in terms of adrenal conditions, you can have true excessive adrenal hormones, which is like Cushing's disease and Cushing's syndrome, or you can have true deficiency of adrenal hormones, and that would be Addison's disease. But nothing else in between is considered a disease. And because Western medicine is so focused on treatment of disease, the term itself it just seems inflaming to providers, is what I found. But the truth is that there are normal cortisol patterns throughout the day. Those patterns intersect with other hormonal patterns and melatonin production in the body. So looking at these hormones and correlating with them with symptoms, and then finding the correct diet or lifestyle or herbs or supplements that we can use to support those people is especially important.
Yeah. So I'm curious when it comes to, I guess, let's just use adrenal fatigue as a particular example, and then we can switch over to, you mentioned endometriosis or PCOS. Definitely, I know a lot of women who were diagnosed with that. But even like, let's look at adrenal fatigue, which I think a lot of people in today's day and age are maybe experiencing to some degree. It sounds like it's a scale. How does Chinese medicine look at adrenal fatigue? I mean, they don't actually have a pattern called adrenal fatigue, I don't think. You can tell me, you'll know better. So, how is that typically viewed? And there are probably multiple patterns associated with that. But, maybe from a foundation kind of macro level point of view, what does Chinese medicine see with patients who are experiencing that?
Yeah, if I were to correlate the common adrenal fatigue syndrome with a Chinese medicine syndrome, I would say it starts first with liver qi stagnation. So there is emotional upheaval or changes to diet or lifestyle that are causing a more surface level stagnation in the body. And over time, you can end up with this spleen qi deficiency. So that's common to have a liver qi stagnation and spleen qi deficiency in the body. If that progresses for a very long time, it starts to tap into the deeper resources from the kidneys. So it starts more surface in terms of things are getting stuck, the energy in the body is stuck. Then the energy starts to get depleted, and then you start to tap into your yin and yang and jing. So I see that in the same way with adrenal imbalances in the body, where it oftentimes happens where people aren't sleeping enough, or they're not sleeping appropriate hours, or they're exposed to a lot of outside toxins or eating poor foods, increasing allostatic load in the body, or they have a very stressful and sedentary lifestyle. So their cortisol starts to get elevated at inappropriate times of day. And cortisol is especially important for normal energy regulation and metabolism. And as that gets out of balance, there's downstream effects from that.
I think that was such a good way to describe it, because you're not just looking at, okay, these are the patterns in Chinese medicine, but how does it actually play out? And I love to see almost, not that I love, because I don't wish this upon anybody. And I I think I've probably experienced varying levels of this throughout my life, but it is kind of a progression, right? Like maybe as you described, like that stagnation that happens, like things aren't properly moving, if people aren't sleeping enough or eating properly, stagnation. And you can kind of tell me if this is correct, but how does stagnation typically show up before it progresses to, a spleen qi deficiency, just to translate it for like symptoms that you might experience when you start with stagnation?
Yeah. So I think the most basic symptom a lot of people get when you have some liver qi stagnation in the body is that tension in the rib cage. We stop breathing deeply. We start to hold ourselves in certain ways. So even before you have symptoms that are of pain or other downstream symptoms from liver qi stagnation, the first thing is people start to hold themselves. And so if you notice tension in your rib cage and difficulty taking deep breaths, that's the first stage.
It sounds like kind of like symptoms of anxiety, right? Like,
Yeah.
would there be some overlap there? Okay. So perhaps that's like one way that it might show up. And then it progresses as we're kind of looking down this, I guess, line. It progresses to something along the lines of spleen qi deficiency potentially. Like, what does that typically look like as things progress in that manner?
Yeah. So as liver qi stagnation progresses, more and more parts of the body get sort of clogged up. And as a result, you have impaired sleeping, impaired energy regulation, and you start to have impaired digestive function. Digestion is the root of a lot of Chinese medicine syndromes, and it's very closely related to the spleen. So as things get more and more stuck, you impair the spleen's natural ability to produce energy in the body, also because of its relationship with digestion and how stress impacts digestion. We talked about how there's the fight or flight response or the rest and digest response in our nervous system. These are constantly trying to be balanced between the two. And once you have enough fight or flight or stress or liver qi stagnation, it impairs the underlying normal physiology of the body or that normal spleen qi production of energy in the body.
And then things get perhaps a little bit more severe where we start to move. You described some sort of kidney deficiency. And I would love for you to define, you mentioned Jing blood deficiencies, and I forgot the qi Jing blood deficiencies, right? From the kidneys. Can you, first of all, define those three for people so that way, for people who are not familiar, like what are we discussing here? And then how does that typically look?
Yeah, so the kidneys are the foundational organ for our longevity, our reproduction, and there are layers within all organs. So the layer of qi is the most superficial layer. It is the basic energy and metabolism of those organs. We also have yin. Each organ has its own yin and yang balance. So yin being the more nourishing aspect, so the actual tissue of the organ, yang being the fire and the more intense metabolic functions of those organs. Blood is another layer of nourishing fluids. And then Jing is something pretty unique to the kidneys. It's that genetic component of the kidneys. It is what did you inherit from your parents, from your grandparents, that is now a part of you that you are carrying forward.
So a deficiency that kind of has now progressed from stagnation to spleen qi deficiency where, now we're not nourishing ourselves because of that stagnation and we're not doing anything about it. It's getting worse. It progresses to some sort of a kidney deficiency in the form of qi, blood, or jing. How does that typically present itself? How do you know that a condition has progressed?
So ideally, you've worked on it before it gets to the kidneys, because then it's a whole nother ballgame
Of
in terms
course,
of
yes.
true reparation. Yeah. By the time someone has their kidneys tapped into, they are exhausted. They can't get out of bed. They've lost motivation. They have other illnesses that are manifesting as well. They are already in the process of having to slow down because their body is so fatigued. In some ways, that means they are at the perfect place for that healing crisis to make the true necessary changes to completely heal and get to the next level. It takes work. It will take showing up for appropriate treatments, eating really well, sleeping really well, because when you've tapped into the kidneys at a deep level, you're having to build from the ground up again.
I want to thank you for kind of walking through this because I think this actually presented so clearly for a lot of people who hear terms like, spleen qi deficiency or liver qi stagnation. I mean, if you get acupuncture and you've asked your acupuncturist what is going on, you might have heard any number one of any of these terms. And I think it's really difficult to translate, okay, what are we actually talking about here? And this example, I think, really will resonate with so many people because as I'm hearing you describe the symptoms associated with each of the stages, and you can see how connected they all are, I literally am thinking through like my own example of like a past life where I had, a 6-month period of extreme stress, overwork, lots of poor eating habits, right? Where I was like grabbing chips for dinner because I wasn't taking care of myself because I was working so hard at the time in the tech world. And the anxiety that first started, the insomnia that progressed from that, the digestive issues that progressed from that. And then I remember you describing, I think it was probably between around stage 2, like the spleen qi deficiency, maybe moving a little bit deeper, but the experience of kind of things are not properly functioning in terms of like fight or flight. I would experience in my own kind of cycle of this panic attacks as I was falling asleep. So as I was trying to really rest, that's when I would start to experience panic attacks. And so I just can see how this progression kind of got worse and worse and worse, where at first it was just a little bit of insomnia and I was just tired and I was using coffee to stay awake all the time, but it started to get worse when I did not take care of it. Does that sound like kind of a pretty decent example of what we just walked through as we talk about some of the conditions of perhaps related to your adrenals as they kind of get a little bit more severe?
Yeah, for sure. And I'm really sorry you had that experience. It's not that uncommon, is what I'm seeing. We live in a society where we are asked to work really hard. And I listened to your last episode with Ariel from Muse, which was incredible. And she mentioned about you can have it all, but you have to redefine what all means. It can't be what your boss wants and your partner wants and what greater society wants. At some point, you need to realize what's most important to you, what your body can actually handle at that moment, and merge them. And that means pruning some things a lot of the time. And that can be a painful process in its own right, because there's only so much we can really do with our time and energy and continue to truly deeply enjoy life. So I see that in my other patients as well, how they get sucked into these needs to show up for this and this and this and this and this and this and that. And then they're so exhausted and they come to me and they want a medication or they want a procedure or they want, a supplement regimen. And I'm telling them, you need to go to bed before 11 p.m. You need to get 7 to 8 hours. You need to wear blue blockers and stop staring at screens before the evening. You need to eat whole foods. You need to take a deep breath and meditate. And that is not the answer we're accustomed to getting from our medical professionals. But at the root of it, it is the most important things we need to be doing.
Yes. Thank you. Thank you for calling that out because it's true. There is a trade-off, right? Like it isn't this endless supply. And if you're quote burning the candle at both ends, you literally are burning the candle and it will become depleted if it's not being nourished. So I would love to hear in terms of, we started to talk about Jing and essence and that genetic component. I'm so curious because I think this deeply relates to longevity, which is an area that I know that you focus on. When it comes to longevity, when you're working with your patients, for women specifically, first of all, how does Chinese medicine think about longevity? What are some of the things that they look at, Chinese medicine looks at in terms of, okay, you're on track, things are looking good versus maybe here are some patterns that might be signaling that something is amiss?
So Chinese medicine views longevity as multifactorial. And that's actually the same in allopathic medicine as well. Chinese medicine talks about kidney jing and kidney essence. It is this finite amount of something miraculous that you received as a birthright, and your job is to preserve it throughout the rest of your life. And you preserve it by maintaining balance and other organ functions. So you preserve it by keeping the energy moving in the body so you don't get stagnation. You preserve it by supporting good energy in the body with good breathing habits, good dietary habits, good sleeping habits. You preserve it by avoiding known toxins and extreme environments. So, our job is to live kindly to ourselves, to treat our bodies kindly, and to live slow and to appreciate our bodies and know that these are our temples for the rest of our lives. And they are finite, but we can maintain them very well.
So, when it comes to longevity in general, how does Chinese medicine specifically look to, I guess, gauge like where somebody is in terms of, are they on a path where they will be healthy in older age? Like, what should we be doing at the different stages of life that we're in? And also, like, what would be some signs that we can look for to determine if we're, kind of heading in a good direction, heading in a not so great direction? Not to scare anybody, because we'll talk about ways to actually adjust this, but just to kind of gauge like where we're at. And also, does age is it a factor in this?
Yeah, I love to think about age. I live in San Francisco, and I believe you do as well. And I remember moving from the East Coast to San Francisco and being astounded by how well people were aging here relative to environments I'd lived in before. First, at that point, started to realize that aging is a construct. It's in our heads, and it's how we're treating our bodies. And there are some things outside of our control for sure, but those have a huge role in how we age. My husband and I are kite surfers, and we're learning how to wingboard. And so we're out on the water and we're at the beach as much as we can be. And I am on the water next to this 83-year-old man learning to wingboard. And you don't see that everywhere. So it's wonderful to be in a cultural environment where people decide, I am going to use my body to its potential and enjoy it for the rest of my life, instead of deciding, I'm old, I will now start doing the things that old people do, because that is going to age you quicker than anything else.
I love that. I love that there's this gentleman that's 83 kiteboarding, right? Or wingboarding. I don't know what he was doing. It all sounds very extra and cool, something that I personally know nothing about. But how did he get to that point? Is it all genetics? Is it, that he slept a lot? I mean, is it the right foods? I mean, you're probably going to say it's a blend of all of it.
I can't speak to the lifestyle that this man is living outside of when he's kite surfing. So I think his story speaks specifically to the importance of mindset and our intention to age well and our intention to enjoy our bodies to their greatest capacity. When I think about what are signs that we are heading down the aging pathway, a lot of functional medicine looks at aging as an accumulation of toxins and improper hormone signals in the body. So anything that we can do to keep our body as clean as possible is going to be especially important for preserving it. And many people have symptoms of fatigue or difficulty sleeping or bloating, digestive discomfort, true diseases. The truth is that those symptoms are common, but they're not healthy and they're not normal. And Chinese medicine in particular believes that there is this way for us to continue to work our way back to feeling good at all times. How our body feels is an indicator of how we are aging and the state of our health in general. So it is not about arriving at a destination. It is continually tapping into the communication that our body is giving us and using that as a guidance to tweak our diet and tweak our lifestyle and shift our relationships and shift how we speak to ourselves and what we think about. And it is completely holistic. But if you are having symptoms, it is information that your body is giving you that it needs a little bit more love and support in one way or another.
Amen to that. I think that is such a powerful statement, because in our society, if you're tired, you drink a coffee, right? Like, it's not about necessarily going to sleep. Or if your stomach hurts, you just grab a Tums. It's not really about investigating if that food was particularly nourishing for you. Question about a milestone that a lot of women, or I guess most, if not all women, will go through at some point, right? Menopause. there is this notion, because on prior episodes, I've definitely talked about, pain around your cycle. That's not normal, that, a horrible PMS experience is not very great. I want to talk about the other kind of experience that women will have, which is menopause. And I know that there are a lot of symptoms associated with menopause. In Chinese medicine, like what is that? How should that experience be for not should as in this is right or that is wrong, but if things are flowing, if there isn't a deficiency or an excess and things are in balance, what does that experience really look like?
Yeah, so menopause is going to happen whether we like it or not. There's going to be a time in our lives when we are shifting from being in the reproductive stage into being in the wise woman stage. So it's important for many reasons. There are symptoms that a lot of people experience as a result of menopause hormonal shifts. And I would say that the symptoms you experience during your menstrual cycle, the symptoms that you experience in your day-to-day life, if those are more intense and those are indicators that your body is out of alignment, they are indicators you will probably have some more difficulty during menopause as well. So the better you take care of your body for your menstrual cycle health, for your day-to-day health, for supporting your adrenals, for just living a healthy life, will make the transition much easier. I have now continued on to my training in functional medicine, and I've actually learned a lot of really amazing things about bioidentical hormone replacement. So hormone replacement therapy is something that when I studied Chinese medicine, I thought, oh God, that's barbaric. Why would I ever do that to anyone? But I've since learned that there are some amazing healing characteristics that estrogen has in the body. And when given at really appropriate low and physiologic doses and trended with specific labs, it can protect your heart, it can protect your bones, and it can improve a lot of symptoms of aging in general. There's a lifespan for how long you can provide hormones to people, but when given at the appropriate time and in the appropriate form, it can be a really healing and nourishing thing for women going through menopause. And generally, the earlier you start receiving them, the safer it is. I would say that I am certainly going to be doing some bioidentical hormones for myself, and I'm prescribing it for a lot of my patients because what happens when you go through menopause is that your ovaries stop functioning normally. They start spurting hormones and then they stop, they at other points will not spurt out hormones. And so you have these wild hormonal variations. And it's those variations that are causing symptoms in women. You can prevent the variety of those variations by having good diet, having open and clear detox pathways, by sleeping well, by supporting your adrenals. But there is going to be variations in your hormone levels as your ovaries change their function. Hormone replacement therapy can make that transition a lot easier and prevent a lot of those symptoms. And then after a safe period of time, you can then taper those hormones. And so you don't necessarily have to have those extreme symptoms if they are managed properly with the diet and lifestyle piece, the general well-being piece, but also the newer options that we have in functional medicine.
And that, my friends, is how you can combine the two right there. Such a good example. All right. I know I literally could just keep going and going with all the questions. I do want to ask you one more because I think this is pretty important. You talked about how, the symptoms we're experiencing today and how we treat our body today will be reflective in how we go through these major milestones. And there is kind of this notion, at least I'm going to speak to it myself. It's my experience. It's a lot of the experiences of women who have reached out to me, who have listened to this podcast. This notion of kind of achieving and striving in all areas of life, right? Like you get up in the morning and you go to that boot camp class, and then you go, and in my case, you study or you work all day, and then you meet up with friends and you're kind of making all this happen. What are your thoughts on how that is potentially affecting our well-being now and in the future? And how do we know when too much is too much? Because for me, I'll just use myself as an example. I can do that circuit training class and then, shower, grab my coffee or tea and walk out the door and then go to a full day of classes and then perhaps, work on the podcast at night. But I'm worried that I'm overdoing it. And so for women who are listening to this, perhaps thinking the same way, now that we've properly emphasized how important balance is, what are your thoughts on how to recognize if you are or you aren't in balance?
So some people naturally can do more to their body. Their body can experience more intense environments and lifestyles and rebound much quicker. Some of that is genetic or your Jing, and some of that is how you are fueling it with really good quality foods and good self talk. And I know that you meditate, so the time you take with that space. So it is a balance in the sense that if you are doing all of those things and you are not having symptoms, it means that your body is tolerating them okay. So if you are getting up and you're going to your workout class and you're going to your classes and you're making your podcast, but you generally feel like your mood is stable and your energy is okay, you have enough energy to get through the day, and then you're sleeping okay and your digestion is good, that means your body can tolerate all of that and that you are fueling it appropriately. But if you start to experience symptoms and symptoms accumulate and become diseases, then it's time to look at the whole picture. And sometimes doing that with a provider, your acupuncturist or your PA, to help you piece apart what's going on in your life and maybe what can be shifted first to support coming back into alignment.
I think that's a really good litmus test. And I want to emphasize, not every day looks like that. Okay. Like I purposefully schedule like nothing in my day, but it's something that I always think about and worry about now that I know about this perspective that Chinese medicine has on balance. All right. Well, question for you. How do you balance? Because I know you are a practitioner, you are a mom, you're a teacher, you're a wife. How do you balance it all?
I balance it all by a number of different things. I shifted my job dramatically when I found out I was pregnant. I realized working in the hospital system, 12-hour shifts, that worked when it was just me. It did not work as becoming a mom. And so I made some shifts in my career. I nourished myself by investing in my own private functional medicine and acupuncture and Western medicine integrative healthcare business where I can schedule patients around what feels good for me so that I can show up for my work and feel nourished by it and support people at the same time. So I made some career shifts to really balance out the new life that I was creating. I also take time to play every single weekend. My husband and I are on the water. We bring our little baby to the beach and we trade off who gets to go play. And then we have complete downtime. So cuddles on the couch, watching a really good movie together, or Elmo if it's Claire's decision. But just that human touch and closeness with one another and blending all of those together.
You are so cool. I just cannot wait for some of your students to listen to this. I think this is going to be fantastic.
Oh man, that's funny.
You are really cool.
I know, I don't realize.
Well, people already think that. So this is just going to emphasize that. All right. I could keep going on and on and on, but we're almost at time. So I would love to ask you, what do you have coming up that you're excited about that you want people to know? Because I know everyone's going to want to know what it is after listening to this. And then how can people find you?
So I am embarking on a new group program for moms, not necessarily new moms, but moms that want a combination of a whole foods diet approach for detoxification and weight loss, in addition to mindset and emotional mastery work to support the fact that you don't change your body without changing your mind and your heart. So I'm actually launching this program with my mom, who's a women's pelvic floor PT, as well as a women's transformational coach. So we are bringing our skills together to create this program. The beta is launching the end of September, so maybe before this podcast comes out. But I am planning to run this program in different iterations for moms in the future. And my mom and I are going to tweak it to also make a program for middle-aged women who are going through struggles of perimenopause. There's nothing specific to the diet, one or the other, that is especially important for pregnancy patients or menopausal women, but we would love to create these safe, sacred containers where women can be with one another in similar phases in life as they are charging into what they are trying to create for themselves moving forward. So that's what we are creating. So the Mama program first launches the beta group September 23rd. And then my own little functional medicine practice is also taking off. So I still have some room for new patients if people are interested in connecting with me in the state of California, because that's a licensed position. But I love to work with women on finding root causes of their symptoms and their diseases and helping them figure out how to heal themselves.
And we're going to link all of the links for your website and your page in the show notes. Oh my gosh, this was such an incredible conversation. And I feel like we covered so much. I just want to say thank you for sharing your wisdom with us and for joining us as a guest on the podcast, Jessica.
And thank you for creating this amazing space for all of these different providers and people with amazing backgrounds to come and share. You have a great capacity to connect with people, and this podcast is a true gift.
Thank you. And thanks everyone for listening. Hello, incredible humans. Thank you so much for tuning into this episode of Nourish. If you enjoyed this conversation, please consider leaving a review or sharing it with a friend. Reviews really help this podcast grow and reach a larger audience, and I'm so grateful for that. I publish new episodes twice a month, so hit the subscribe button to be notified. And if you'd like to learn more about the work I do as a holistic life coach or to connect, please check out the show notes or find me on Instagram at Mira_wellness_co. See you next time.